To Pedodontics. So the long answer question, short answer questions will come on this topic. Okay? Introduction to Pedodontics. In this we will cover in this topic. We will see the introduction, the definitions given by A to B, the emblem of the dentistry, the difference between the general dentist practitioner and the periodontist. What is the difference between both? What are the different milestones in dentistry for children? We will see the Indian history of periodontics, the pediatric triangle, the aims and objectives of periodontics. So these aims and objectives will be a SAQ for you. Aims and objectives of periodontics. Scope of pediatric dentistry. This is also one of the SAQ which comes. Comprehensive dental care. Okay. And what are the changing trends in pediatric dentistry? What has been changed? How was it before? How is it now? That we will see. Then we'll conclude the topic. Okay? This is not a big topic. This is very short topic. We have not so much slides also. So first we'll go to the introduction. So whenever a long answer question comes to this introduction, aims, objectives, and scopes of pediatric dentistry, this is a long answer question which is asked. So you have to write this content first. What you are going to present in your answer, the long answer to. So the long answer question is big one. It has like 35, 15 marks. So first you have to write the contents of your answer. But, this you can take the screenshot also, and then you elaborate one point. Like in introduction, you write then write the definitions. You will get idea what you have to write in your answer. So this will be a nice frame of your answer. So okay, then this is the contents. Now we will see the introduction first. As we know that there is a pediatrics branch in MBBS, after special in medical specialty, there is a pediatric branch. So in dentistry also there is a pediatric dentistry branch. It fulfills a very special purpose related to the dental specialty. That is, it is oriented to comprehensive and continuing the dental health of the special group, the young children, rather than to the specific dental issues, diseases, or anomalies. So, in brief introduction, you can write like as a pediatrics, it is a branch of medical specialty. The pediatric dentistry is also a very special purpose and branch of dental specialty. And what we do in pediatric dentistry, that we do the comprehensive dental health of special group. That is, special group means the young children. Very special group. Very special group means the छोटे छोटे बच्चे होते हैं उनको अपने यहाँ पे वेरी स्पेशल ग्रुप बोला है the young children. Okay, and then we see the what we see in pediatric dentistry. We see the specific dental issues, disease or anomaly related to the child patient. Now this is the introduction. It's very easy. You can write in your own words also if you understand it. Now, what is the importance of pediatric dentistry? It is one of the most important branches of dentistry, as we know that pedodontics. This word is derived from Greek word. Pias means child, and dontics means study of tooth. And we know that whenever child patient comes in a normal TV, then the doctor gets frustrated that first of all the child is very cranky, he is not able to listen, he or she is not able to listen, they are in their own world only. So it's very difficult to manage such patients. So behavior management is a very important part in pediatric dentistry. So whenever a pedo patient comes, so we will see in detail what pediatric dentistry is enveloped with. Okay, so what all points are there in pediatric dentistry. So now this is the importance of pediatric dentistry, that we see the special child, the young child, infants, neonates. Okay, everything we see the oral dental health issue, diseases or anomaly. Now, what is the definition of pediatric dentistry? Now, this is a very common question. Whenever you go in Viva, this is very favorite question of every staff. Okay, define pediatric dentistry. So you must know the one definition एकदम thorough. Thorough it will be like कभी भी आपको पूछा तो आपको आना चाहिए definition. Okay. Now I have taken here only two definitions which are important. From these two also this AAPD is very easy. AAPD1. Now the first definition which is given by Stewart, Barber, Trotman, B in 1982. The pediatric dentistry is the practice and teaching of comprehensive, preventive, and therapeutic oral health care of child from birth to adolescence. Now, what is it? It is a practice which teaches the preventive. But we all prevention we take on in child. If a child comes to you at the age of 3, so we can see the how much tooth are there involved. There are caries or not. We can give a prevent like sealants लगा दिया फ्लोराइड ट्रीटमेंट कर दिया दैट इज अ प्रिवेंटिव ट्रीटमेंट कि आगे चल के केरीज ना आए और आगे चल के माल अक्लूजन भी ना हो जैसे कि आगे चल के आपको ब्रेसेस लगाने पड़ते हैं एडोलेसेंस में टीथ आपके आगे पीछे हो जाते हैं तो आगे पीछे टीथ वाले क्राउडेड टीथ होने की वजह से भी केरीज होते हैं so because of that we can take preventive treatment in pediatric dentistry so आगे चल के आपको इंटरसेप्टिव ट्रीटमेंट करने की जरूरत नहीं है Now, it is constructed to include care of special patients who demonstrate mental, physical, or emotional problems. Now, in this pediatric dentistry, we take care of special patients also, like those who are mentally disabled, physically disabled, or those who are having emotional problems. Like you can say the cerebral palsy patient, autism, Down syndrome patients. So this is all covered in this pediatric dentistry, special patients also, special child. There is one topic only like special healthcare needs, treatment of special healthcare needs. So there is this is a different topic only. So okay, we got this. This is one definition. We have given stream and target purpose care and ability to. If you are able to remember this definition, you can pick back this definition. Otherwise, you can go through this definition. This is given by American Academy of Pediatric Dentistry, 1991. Okay, very easy. Okay, so you have to थोड़ा उसको रटना पड़ेगा आपको बिकॉज ये डेफिनेशन आपको रटना पड़ेगा कभी भी आप जाएंगे वाइवा को जाएंगे कभी भी कौन सा भी ये होगा अगर आपको इंट्रोडक्शन एक सब्जेक्ट पे क्वेश्चन आया तो फर्स्ट यू हैव टू राइट डेफिनेशन ऑफ इट ओके Pediatric dentistry is an age-defined specialty that provides both primary and comprehensive preventive therapeutic oral health care for infants and children for adolescents, including those with special health needs. So what it is telling? It is a brand, it is an age-defined specialty. Why it is an age-defined specialty? Because it is related to particular age group only. You know, in pediatric dentistry, we see a particular age group patients only. So it is called as an age-defined specialty, which provides the primary and comprehensive. Primary treatment भी होता है, इसलिए fluoride application वगैरह, and comprehensive root canal surgery, surgical procedures भी होते हैं. तो preventive भी होता है, therapeutic oral health care होता है for infants and children. तो adolescents for oral health care होता है for infants जो new adults होते हैं infants होते हैं children होते हैं through adolescents in the age of 15 we see the patient with pediatric dentist okay and including those with special health care special health care जो अभी बोल रहा था जैसे कि mentally physically and emotionally disabled patients so this two definition you must be prepared okay now after
मैम
definition
आवाज बहुत कम आ रहा है
okay now are you able to listen now hello hello is it okay now
नो मैम
now is it okay? Hello? Is it
यस
okay?
मैम यस मैम
Okay, it may be because of my mask. I will pull it out. Okay, then we will see the envelope now. Now we have seen the definition. Till now you have got everything. Now introduction, the content. We have seen the introduction. What is what we see in pediatric dentistry and what is the importance of pediatric dentistry branch. We have seen the definition, two definitions. Okay. Now the envelope. Now this is very common question which is asked. It is very favorite Viva question also. The what is the envelope? Envelope means what? Any brand जो होता है ना एक symbol होता है किसी भी चीज का उसको बोलते हैं envelope. तो अपने dentistry का what is the envelope of dentistry? So you have draw this diagram. Okay. There are three circles. Uh, Envelope of pediatric dentistry. Three circles. There are. This is line. There is a wings, serpentines, wings. Okay, you can take a screenshot of this. Okay, you have to write draw this diagram if you are getting this question. Okay, now the envelope is based on triad of keys. You know the triad of keys that child, patient and parent, child, dentist and parent is a three triangle. Okay, it is based on that only, the triad of keys. Okay, you will be getting it after that. Now, wherever there is area of intersection, you can see here is the area of intersection or triangle is formed over here with three circles. It denotes delta sign of dentistry, okay, which is a periodontic triangle which is given by right, okay, and the top circle it envelops the IDA staff, Interdental Association staff of Escalpus with wings of serpentis. You can see the wings, two wings are there. The wings represents the spread of knowledge. So this is very easy. If we get the question, if we have drawn this diagram, it is very important. And without diagram, we cannot get the marks. Now, the envelope. Now we will see the difference between a general dentist, general practitioner, and a pedologist. Now, generally, whenever there is, huh, one second. Okay, then we will see a difference between a general practitioner and a pedologist. Now, there are two main issues, two issues that we delineate the pediatric dentist from a general practitioner. So first you know that the child management part. As in child management, the child is very cranky. वो छोटे छोटे बच्चे होते हैं कभी कभी एक साल का, 2 साल का, 3 साल का, they are not able to listen only. So this child management part is very important in pediatric dentistry. Okay, so in child management there are behavior management is there. So behavior shaping is there. The pharmacological behavior management, non-pharmacological behavior management. There are different aspect of management that is a different question only. So this only what the difference is the periodontist. As a periodontist, you must know the child management part, and second is that you must understand the complexities of growth and development. Whenever a child is coming to you at the age of 3, you must know that his maxilla is growing properly or not, his mandible, his skull is growing properly or not. If it is not growing properly, you must have a follow up of that thing. And if you are finding any problem with growth and development, so you can refer to another specialist branch. Okay, because the child is coming to you for a checkup, regular 6 months follow-up is there. So whenever the child comes to you, you must see all these growth and development parts also. Okay? Which tooth is coming, which tooth is not coming, which tooth has came. It is came at you know the chart. You know the chart, है dental chart, the canine settle sizes, lateral sizes, at what age they comes. So if they are coming or not, so you must take the follow-up of all things. So these 2 points you are the difference between a general practitioner and a periodontist. Okay. And a general dental practitioner is ideally suited to attend only the overall needs of the family, but the specific problems of the child management and complexities of growth and development of child patient is referred to the periodontist. Okay. Now we will see the various milestones in pediatric dentistry. Now this is a very common question. The milestones in dentistry for children. Okay. So this only wait. आई हैव टेकन आई हैव नॉट टेकन इट बहुत सारा एक्चुअली इसमें बट मेरे भी बहुत छोटे छोटे के लिए है ज़्यादा कुछ लिया नहीं है इसमें okay? So you can also take a screenshot because we have to इसको रट्टा ही मारना पड़ेगा ये चीज़ ऐसे देखी होगा समझ पे याद रखिएगा ओके तो ये 1900 few children are treated in dental offices and little or no instruction in care of baby teeth were given. Okay. In 1924, the first comprehensive textbook on dentistry for children was published. Okay. In 1935, the 6 graduate and 8 postgraduate programs exist in economics. So इसमें कुछ सब जाने जैसा नहीं है ये आपको याद ही रखना है. Okay, in 1940 because these are milestones and you must know these milestones. Okay, in 1940 the American Society for the Promotion of Dentistry for Children have changed its name to American Society of Dentistry for Children, that is ASDC. This is a long form of ASDC. Okay, in 1922 what happens? The topical fluid application has been used for preventing caries. In 1945, the first artificial water fluoridation plant was begun at Grand Rapids. Okay, these are very MCQ questions also. MCQ questions भी आते हैं इसमें. First artificial water fluoridation कब हुआ था? So the years are covered. So it is in 1945. Okay? So in 1947, the American Academy of Periodontics was formed. In 1949, the first full week of February is designed as National Children's Dental Health Week. In 1955, the acid dish technique was described. In 1974, the International Workshop on Fluorides and Dental Caries Reduction recommends fluoride supplementation start as soon as after birth as possible. Okay, in 1981, as we know that February is designed as a National Children's Dental Health Month. Children's Dental Health Month. Okay? And in 1984, the American Academy of Periodontics changes its name to American Academy of Pediatric Dentistry, which is it used now also, the AAPD, American Academy of Pediatric Dentistry. This name is used now also. Okay, now these are few milestones. So you will get a MCQ question also on this. So you have to pick that. Okay, there are only 3 slides. So 1, 2, 3. Now, what is the Indian history about periodontics? Now, we have seen this in US, like all over the world, we have seen this. What has happened? In Indian history about periodontics, you will see here. In 1920, the first dental college, that is Calcutta Dental College and Hospital, it was opened by Dr. Rafiuddin Ahmed. It is called as father of dentistry in India. Okay? So there is very confusion. Okay? Father of periodontics in India, the father of dentistry in India. So ऐसे questions, so MCQ questions आते हैं ना, so you must read it very carefully. Okay? This is father of dentistry in India, but who is it? Is Dr. Rafiuddin Ahmed, and the father of pediatric dentistry in India is different. It is B.R. Voucher. Now in 1935, there was a license in dental science. We have get a license about the bachelor in dental surgery. BDS का license मिला था in 1935. And in 1950, the first government dental college Amritsar started Pedodontics as a specialty branch. Okay? In 1915. Now in 1917, Pedodontics was as a specialty for undergraduates. अंडरग्रेजुएट्स को पीरियोडिक्स एक स्पेशलिटी ब्रांच बोलकर आया था ठीक है फिर 1979 फिर ISPPD दैट इज इंडियन सोसाइटी ऑफ पीरियोडिक्स एंड प्रिवेंटिव डेंटिस्ट्री दे हैव होल्ड द फर्स्ट कॉन्फ्रेंस ओके अभी भी उनके कॉन्फ्रेंस होते हैं आपको पता होगा हर साल में कॉन्फ्रेंस होता है पर फर्स्ट कॉन्फ्रेंस कब हुआ था इन 1979 ओके और of that they have started now see here the Dr. B.R. Voucher is is the father of periodontics in India. Okay, so we have seen here the father of dentistry in India is Dr. Rafiuddin Ahmed. The father of periodontics in India is Dr. B.R. Watcher. So you have to read the MCQ question very properly and then answer. Okay, बहुत जल्दी भी यहाँ पर टिक कर लगते कुछ भी. Okay, now see in 1982, the Indian Society of Periodontics and Preventive Dentistry becomes an affiliated member of IADC. Okay. Now, these are various milestones of this history was to know these points. Now we will see the difference between an adult patient and a child patient. What is the difference between an treating an adult patient and a child patient? So as you know, the adult patients are static. वो उनको बेटा की बैठो बाबा चेयर पे वो खोलो तो वो खोल देते हैं। वैसे बच्चे नहीं होते, छोटे बच्चे को आपको बार बार बोलना पड़ता है कि बाबा वो खोल के रखो, वो बंद मत करो, तो दे आर वेरी टाइड अप. So in adult patient they are static, but the child patient they are very dynamic. Okay. Now in preventive plan in adults they prevent recurrence of disease but does not prevent disease. Okay. Prevention जो preventive part होता है adult patient में, it recurs the disease, मतलब recurrence हो जाता है but it doesn't prevent the disease. Okay. But in periodontics, what we do, we prevent the dental caries, we prevent the disease, okay? But in this adult patient are not able to prevent the disease because वो पहले से ही caries लेके आए होते हैं, okay? तो फिर और पीडो पेशेंट में अगर अपने पास रेगुलर रूप से फॉलोअप है हर 6 मंथ, डेली हर 6 मंथ्स अगर पेशेंट आता है फॉलोअप के लिए सो कैन प्रिवेंट डेंटल केरीज पीरियोडिक डिसीज एंड मालाप्रेशन. So in adult patient, the dental and patient relationship is really linear. Only dentist and patient is there. But in child patient, there is a this relationship is triangular relationship. Why it is triangular? Because the parent is involved. In child patient, whenever we treat, the parent is involved. Okay, because it is a triangular. And in adult patient, it is a linear. So this is also very common in situation it is asked. Okay. You are getting it decided is triangular because the parent is involved. Dentist, patient, and parent. तीनों involved होते हैं child में, child patient में because so the relationship is triangular. Now the child is not just a small target, but one that is moving, constant state of transition with changing health needs. Okay, child is not just a small target; it is a very moving, constant state. Okay, आपको तो पता है child patient एकदम यहाँ से वहाँ घूमते रहते हैं. So they are not constant state. They are not in a constant state. Okay. So this is the difference. Now what we have seen the periodic triangle. This is what I am telling you. This is a triangle. The child is there, dentist and parent. तीनों involved होते हैं periodic triangle. So this is a very common question. इसमें SQ आता ही है short answer question. Okay. And adult patient. What happens in adult patient? Only the dentist and patient is there. But in a pediatrics, what a pediatric patient, what happens? There is a child, so is a pediatric triangle. Okay? Now we will see the aims, objectives. What we have seen, you are getting it till now. What have we have seen? We have seen the periodic triangle, which involves the parent also. So it is a triangular in shape, but the adult patient are linear in shape, as they are involved only dentist and patient. The child patients are very dynamic, and the adult patients are static. Okay, now we see the aims and objectives. Okay, we will see now the aims and objectives. There is a time here. Now, this is a as I have told you before, so this is a short answer question. We will get aims and objectives of pediatric dentistry. Okay, this is a common question you will get aims and objectives. So you have to write. I have taken a very few points over here, but you can read the book and write it very nice answer over here to understand to you. I have taken very few points. So what are the aims and objectives of pediatric dentistry? So we create only not only a good patient but also a good citizen of tomorrow. We create what we, the child patient. Not only child patient जब आता है तब वो बहुत क्रैकी होता है तो फिर वैसे वैसे जैसे जैसे आप उसको बिहेवियर मैनेजमेंट देते जाते हैं तो इन फर्स्ट विजिट ही इज वेरी क्रैकी बट इन सेकंड विजिट ही थोड़ा कोऑपरेटिव हो जाता है इन थर्ड विजिट फुल कोऑपरेटिव हो जाता है पेशेंट. Now he has become a good patient now. He understands the things what is good to him and what is bad to him. He is able to differentiate between this. So he will become a good citizen also of tomorrow. Okay, whenever the child patient comes to us, so he becomes a good patient as well as a good citizen also for tomorrow. Okay. Now second, what are the aim and objectives? Second point is it is we have to instill a positive attitude and behavior. Positive attitude and behavior अपने को instill करना है patient पे. Now introduce and implement the principles of preventive dentistry from birth. Uh, we have to introduce just pediatric dentist के पास ही बच्चा आता है तो फिर बस वी हैव टू इंट्रोड्यूस द प्रिंसिपल्स ऑफ प्रिवेंटिव डेंटिस्ट्री फ्रॉम बर्थ अर्ली कि ब्रश करना है रेगुलरली 2 टाइम्स ब्रश करना है हाउ टू ब्रश विच मोशन which brush is used how much toothpaste you have to use while brushing. So these are all the principles. ब्रश कैसे होना चाहिए, ब्रश कितने टाइम पे बदलना चाहिए, तो ये सब प्रिवेंटिव मेजर्स जो होते हैं ये हर 6 मंथ्स को फॉलोअप रहना चाहिए. क्या खाना चाहिए, क्या नहीं खाना चाहिए, क्या खाने से आपके दांत में चिपक जाता है और फिर कैरीज बढ़ते हैं. So these are all the preventive measures we have to implement put there from birth only. Okay. Second is the parental guidance and counseling in regards to treatment modalities and different facets of preventive dentistry. So, as we know in pediatric dentistry, the relationship is triangular. The parent is also involved, so we can give knowledge to parent also. Okay, so parental guidance and counseling. पेरेंट्स को भी काउंसलिंग करना है कि कैसे कैसे जैसे कि अभी एट द एज जैसे छोटे बच्चे होते हैं न्यूनेट्स तो फिर उनको तो ब्रश करना नहीं आता है तो एट द एज ऑफ 6 मंथ्स फर्स्ट टू पीरियड. ओके, सो हाउ सो पेरेंट्स को काउंसलिंग करना है कि कैसे ब्रश करना है दांत गॉस पैक उंगली में ऐसे गॉस पैक लगा के फिर टीथ क्लीन करना है, तो ये सब काउंसलिंग करना है. सो टू प्रिवेंट further caries to appear. Okay, so today we will see it in here only. Aids and objectives. This topic आपको लगेगा